Our dear viewers, we once welcome you to Imokili.tv. I'm John Rich Wilinde. We are here at Butabika Referral Hospital to talk about mental health problem. We are here with Dr. Basangwa to talk more about mental health in Uganda.
Yeah, I'm Dr. David Basangwa. I'm a senior consultant psychiatrist at Butabika Hospital here, and also Deputy Executive Director. Butabika is our national referral mental hospital. We offer care especially for the mentally sick, referred to us from all over the country. We are also a teaching institution for various universities, especially around Kampala. We do research and we do support supervision to other health facilities in the area of mental health.
Okay. So, doctor, now what is the state of mental health in Uganda today? What is the state like?
Well, mental illness, like is happening the world over, is on the increase. We are having more and more people suffering from these various mental disorders. It's estimated here in Uganda that probably about 20 to 35% of our population do suffer various forms of mental disorders. Of course, not all requiring treatment. We find probably about, of those, probably about 16-20% requiring treatment. So we see it's an increasing problem. We need to prepare for the many people that are coming to the institutions all the time. Of course, there are also many out there that are not able to access treatment, especially people in the rural areas. But the good thing now in Uganda is that we've been able to decentralize services for the mentally sick. They can access care at the regional hospitals, at the district hospitals, even at health centers. Yes.
So, doctor, if someone is sick, can they? Okay, when you say there are very many, is the treatment adequate?
Yeah,
do you have enough professionals? Do you have enough equipment?
No, in terms of professionals, specialized professionals, we are still few, because when you look at the psychiatrists, we are only 33 in the entire country. So that means we have 33 psychiatrists to cater for a population of 33 million. Now that's a very, very small number. It means every psychiatrist has about 1 million people to look after. So in terms of human resource at that level, we are really very, very few. So what we've done in this country is that we've trained many other people. Another cadre of staff we call psychiatric clinical officers, who we train in this hospital. And these are people that are very, very well qualified in terms of offering community mental health services, and they're the ones that are doing the bulk of the work at both the regional referral hospitals, the district level, and the health centers.
What about in terms of facilities?
The facilities, I could say we are well advanced in this area. We've had the mental health units built at every regional referral hospital. So we have 13 new mental health units across the entire country. And I'm happy to say this is the first time really government has made such big investment in mental health care. And this has a lot improved the care for the mentally sick. These units are also equipped. The only problem they have, which we are struggling with, that we hope will improve in the near future, is the human resource, because they don't have specialist psychiatrists, for example. Out of the 13 regional referral hospitals, I think only 4 have specialist psychiatrists. The others are being managed by psychiatric clinical officers.
Okay.
Yeah.
Doctor, most people associate mental health with witchcraft.
Yeah.
maybe this thing will
cause mental illness. Of course, you can no longer say, I mean, in this age, in this era, that a person who is having mental problem because of HIV/AIDS has been bewitched. Biologically, we are able to explain why a person is developing mental symptoms from the HIV/AIDS, because the virus is causing injury to the brain. This is why somebody gets mental problems. Or somebody might be having malaria, which has also affected brain tissue, then the person develops mental symptoms. Or somebody has been smoking marijuana or taking a lot of alcohol. These also go to damage particular areas in the brain, and this is why people develop mental symptoms. So mental illness does not result from witchcraft, although that's a common myth that we have in this part of the world.
Okay, and even most people, most Africans, believe in superstitions.
Absolutely.
Don't you think that thing can also damage their mental well-being?
No, it doesn't. The only thing is, of course, sometimes for a few conditions, if you believe in them, you can probably get a little affected by the conditions, but not that they will cause mental illness as such. The biggest danger they pose, especially to our patients, is that those who believe in witchcraft as a cause of the mental symptoms would not easily come up to us for treatment, which is not a good thing. This is why we appeal to the public, to communities, that once people suffer mental symptoms, they are suffering a disease like any other, let them be taken to the nearest hospital to be properly cared for, and not taken to the shrine. Of course, some people out there do suffer various complications. You know, mental illness very, very easily manifests in situations of stress. So when people get stressed, they get any other form of distress, it's very, very easy for them to suffer conditions like depression, for example, which is one of the commonest mental disorders. Now, many of our brothers and sisters out there in the diaspora tend out of isolation, out of culture shock, out of difficulties in living, fail to cope with certain situations, and they could suffer various forms of depression, for example. But depression is a well-known condition. It's treatable, and many of them should be able to access care for this kind of problem.
Uganda has been quoted with the biggest percentage in the mental health. What causes this mostly in Uganda? It has the biggest percentage.
No, we don't have the biggest percentage. What we know about Uganda is that we've had, at some point, we were known to have the highest consumption of alcohol in the entire world. That was the WHO report 2004. We've since gone down a little. But in terms of mental health problems, I would say we are just average. We have the 20-30% prevalence, like it's happening in many other countries. However, I must add that we've had unique challenges that have probably increased the number of cases that we have in this country. Issues to do with the common infections, like malaria still tortures us, and there are many people that develop mental symptoms out of malaria, like I said before. HIV/AIDS is still real, it disturbs us, and the number of people who develop mental symptoms because of the HIV/AIDS infection. Actually, over 90% of people who get HIV also get mental symptoms.
What causes that?
Yeah, because the virus also attacks the brain. It doesn't only stay in blood, but also goes to the brain. So this makes it easier for people to develop mental symptoms. Yeah, we have in this country heavy consumption of alcohol. We have heavy consumption of things like marijuana, chewing of stimulants like cat. So all these also go to disturb people's brains, and they get mental symptoms. Until recently, the war in the north was affecting people psychologically, and that also contributed to an increased burden of mental symptoms. But of course, we are glad that now people are recovering from that. Although there are people that are currently undergoing treatment as an effect that they went through before.
Okay.
Yes.
How does mental illness manifest in individuals?
Well, different ways, but the main way is that people develop inappropriate feelings about self and others. They start behaving in a manner that is not acceptable in the community where they live. They see and things that other people may not see. They can hear voices which other people may not hear, what we call the hallucinations. They develop abnormal beliefs about situations that cannot be properly explained. So there are changes in the area of thought, in the area of behavior, in the area of perception, and of course general outward behavior and judgment. I think the world over want people to understand and to appreciate that mental illness is a common condition. It will continue to grow. But the good news is that it's treatable, potentially treatable, whatever one has. So our appeal is wherever one is, if you have a relative, if you have a friend, if you have an employee with mental symptoms, kindly refer them to the nearest facility where they can be helped. Incidentally, the earlier they started the treatment, the better. So let them be referred at the earliest opportunity. There are lots of chances for improvement so that they can get function again.